am Jessica Arumamel, a Level 2 nursing student from Visayas State University. And today I will demonstrate back technique with urine test for albumin and urine test for sugar. So when we conduct a home visit in the community, when we first arrive at the client's home, we first greet our clients. We then state the purpose of our home visit and determine their health needs. Uy! Mayong buntag, ma'am. Kumusta?
Okay ra, mayong buntag. Ikaw, kamusta?
Okay ra sad ko, ma'am. So ako dayto si Jessica Humamil, ma'am, student nurse sa Visayas State University og dinhi ako pag niaging adlaw, ma'am, nagka-istoryahanan na kita kabahin sa inyong pagpuyo dinhi sa inyong balay o kabahin sa inyong health. Unya, ma'am, naa na sad ko karon na ako'y pagabuhaton nga urine test for albumin and sugar. Unya kani nga test, ma'am, ako ipakita kung unsa ang resulta o ako pong i-explain kung unsay pasabot ani nga mga resulta. Unya, ma'am, ako pod i-explain kung unsay kalahian aning ako ang gihimo nga urine test o kanang urine analysis nga mahitabo sa hospital. Okay ra ba nimo, ma'am, kung ipadayon naho ning akong pag-test sa inyong ihi? Wala ba ka may mga buhat-buhat karong adlaw?
Oh, okay ra.
Sige, ma'am, salamat kaadto sa pagsugod, ma'am. Sa dili pa ko magsugod, ma'am, mungutanan ta ko, ma'am, og pwede ba ko makahuwam og kanang lamisa pagabutangan ani ako mga gamit?
Oh, nakigianda man to sa sulod.
Aw naa day sa sulod, ma'am, pwede ba ko muhuwam ato, ma'am?
Oh, okay ra. Sud lang.
Salamat kaadto, ma'am, ha. Musulod ko, ma'am, ha.
Ah, sige, go.
So, mo ni ang lamisa. Kanira may gamitan. Sige, ma'am, salamat kayo. Ha mo gamit ko aning lamisa para pagabutangan sa mga gamit na kinahanglan ani nga procedure. Kanang ma'am, mamaliyog lang po ko sa katong ipaandam ito na akong ihi, ma'am, kay mao may akong gamiton ani nga procedure na atong gitawag nga urine test for sugar and urine test for albumin. Hang kaan na yan lang. Sige, ma'am, salamat kayo. Okay, so upon arriving at the client's home, I'm now going to prepare the materials needed for the urine test. I'm going to prepare first the materials and perform bag technique. So I'm going to place my CHN bag at the table lined with a clean paper. So I'm going to put the paper lining. Okay, so the clean side must be out and the folded part touching the table. Okay, so next I'm going to put the plastic lining. Now I'm going to place my CHN bag at the right side within the area of the paper lining. Okay, so now I'm going to ask for a basin of water or a glass of drinking water if tap water is not available. Then I'm going to open the bag and take out the soap dish and the towel. So, ma'am, naamay ka ng langgana. Pwede kumuhuwam?
Oh, naa.
Sige, ma'am. Salamat kayo na lang, ma'am. Kana magpatabang po lang ko, ma'am, o ka ng buog tubig. Kay manginaw ko una sa ako magpadayon sa procedures.
Ah, sige, okay ra.
Sige, salamat kayo, ma'am. Salamat kayo, ma'am. Kana ipaliw lang po ko ng planggana, ma'am. Pinutan sa kilid. Salamat kayo, ma'am. And then I'm going to get my towel and then wipe to dry. Then I'm gonna place the soap dish and the towel at the upper right corner of the plastic lining. Okay, next I'm going to take out the apron. And put it on with the right side out to protect my uniform. Okay, observe proper technique. And make sure that the apron will not touch the table. Okay. Next, I'm going to put out all the necessary articles for the procedure. And I'm going to place all the materials within the plastic lining. So we have here kidney basin, droppers for the urine and solution, test tubes, cotton balls, alcohol, the acetic acid, Benedict solution, alcohol lamp. We also have here test tube holder, extra towel, lighter to light up the alcohol lamp, and we also have 2 receptacle waste. I'm going to place the waste receptacle within the paper lining and the other waste receptacle beside the kidney basin also within the paper lining. Okay, so now that I have taken out all the necessary materials needed, I'm now going to close the CHN bag and make sure to not leave it open. Okay, so now we can proceed to the procedure and perform necessary nursing care and treatment. Now I'm going to ask the client for the urine sample and some assistance in handling the urine specimen. Ma'am, mamalihog lang ko sa katong ihip itong akong ipaanda, ma'am.
Oh, dara, di ba na? Kikuha.
Sige, ma'am. Ari lang nato ibutang sa brown nga part, ma'am. Kunya atong ipatong muna og papel sa nato ibutang sa paper lining o diha lang, ma'am. Sa brown nga part. Okay, sa paper lining. Sige, ma'am. Salamat kaayo. Since I'll be handling urine specimen, I'm gonna put on clean gloves to protect myself from contamination. Okay, then fix the gloves. Now, since I don't have an assistance, I'm now gonna light the alcohol lamp first before other procedures. procedure for the urine test for sugar. So earlier upon arrival at the client's home, I already explained to the client what I'm going to do today and why it is necessary. So now I'm going to place 6 to 8 drops of urine in a 10 ml test tube. Place 6 to 8 drops. Okay, now I'm going to place the dropper on the extra receptacle. And then I'm going to add 3 to 5 ml of Benedict solution. I'm going to get another medicine dropper. And then I'm going to add 3 to 5 ml Benedict solution. Okay, and then we're going to close the Benedict solution. Okay, so using a test tube holder, I'm going to put the mixture over the flame and then let it boil. We're going to observe changes in the urine. And make sure to not overboil it because tendency is the mixture will vent out of the test tube. And you're going to note that the mouth of the test tube should be away from yourself. Okay, so put it away of the... Okay, so let's put the flame away. And then we're going to let the mixture stand for 1 minute and observe changes in the urine. Now for the interpretation of the result, a blue color indicates absence of sugar and a green color indicates 1% trace of sugar, yellow for 2%, orange for 3% trace of sugar, and a brick red for 5% trace of sugar. So now I'm going to show it to the client and explain the result. Ma'am, hello ma'am, so mo yung resulta sa test ma'am. Green yung color sa ihi ma'am no? Kita ka ma'am? Okay, so ang green ma'am nagapasabot nga naatay nakita nga 1% trace of sugar. Okay, so next is to discard the urine specimen and note that the urine should be discarded in the comfort room. So ma'am, pwede ko gamit sa inyong CR? Ako lang iyabo ning urine sample? Nato. Sige, ako sa nangiyabo ma'am niya. Nibalik na ko ma'am tiwas ko anda. Ato na po ta sa ikaduhang test kato urine test for albumin. Okay ra ma'am, magpadayon ta? Okay ra. Sige ma'am. So now I'm going to discard the urine specimen. So after I discard the urine specimen, I soak the test tube in a soap solution for approximately 10 minutes. So now I'm going to proceed to the next procedure, which is the urine test for albumin. So I'm going to fill the 10 ml test tube about 2/3 of urine. I'm going to use the same medicine dropper I used earlier for the urine. And then place the medicine dropper on the extra receptacle. Okay, so now I'm going to light the lamp. Okay, then I'm going to put the test tube in the test tube holder. And then we're going to boil the urine on the upper part of the test tube. And we're going to observe for cloudy rings. So if we can see a cloudy ring, we can now remove the test tube. Okay, so here it is. So I'm now going to add 5 drops of acetic acid. Okay. 1 drop at a time. 1, 2, 3, 4, 5. Okay, so now we're going to boil the mixture again. And then we're going to observe for changes. Okay. Okay, so as we observe, there are still visible cloudy rings. So note that a cloudy is due to the presence of a albumin. So in this sample, it indicates a presence of albumin. So this result, I'm going to show it to the client and explain it to them. Ma'am, so mo kani ma'am kadto ang resulta sa ikaduhang test katong urine test for albumin. So sa ato nakita ma'am na ay cloudy ring ma'am, no makita ka ma'am? So kani nga visible na cloudy ring ma'am, nagpakita ni isda nga naay presensya nga albumin sa imong ihi. So mag-explain ko unya tataod kung unsay pasabot ani. So ani panahon na karon ma'am, kanang gamit na sad ko sa imong CR, ako na sad ni iya buo niya akong hinduan. Okay ra ma'am? Okay. Kunya nagbalik na ko dinhi ako sa hinduan niya akong mga gamit, then pagkahuman istorya ta sa resulta sa duha ka test. Sige ma'am, salamat kaayo. So now I'm going to discard the urine specimen and do the aftercare. After I discard the urine specimen, the test tube is soaked in a soap solution with disinfectant for approximately 10 minutes before rinsing it. So all these materials that are used in this procedure are considered contaminated. So I'm gonna sanitize all these materials and let it dry. But first, I'm going to discard this urine sample. And I'm also going to bring the kidney basin together with the medicine droppers to also soak it in a soap solution with disinfectant for approximately 10 minutes. So now I'm going to discard. And I'm also going to bring the waste receptacle to properly discard it. So I now have here the test tubes, medicine droppers that I soak in a soap solution for approximately 10 minutes. So I'm going to wipe it off first before I return it to the signage bag. But first, I'm going to remove my gloves and perform hand washing. Then I'm going to place it in the waste receptacle. So now I'm going to bring the waste receptacle. I'm going to discard the waste inside this, and I'm going to bring my soap dish and towel. Ma'am, asa inyong trash can, ma'am? Maglabay at ako ani, ma'am?
Nato.
Sige, ma'am. So now I already discard the waste inside the waste receptacle. So now I'm going to perform hand washing. Ma'am, kanang muha na sad kog tubig, ma'am, ug buham sa inyong tanggana kay mag hand washing na sad ko. Okay. Sige, salamat kayo, ma'am. Ana lang nila, ma'am. Sige. Daghang kayo salamat, ma'am. Napalihog lang po, ma'am, ha? Anong ginamitan nga tubig. So, I'm going to wipe my hands using a towel. Okay, so here are my soap dish and towel. So I'm gonna put my soap dish and towel in a plastic. And then I'm gonna place the plastic in the plastic lining first while I sanitize all the materials. So I have here the cotton balls and alcohol, and I'm gonna start sanitizing all the materials. And then I'm going to put the used cotton balls on the waste receptacle. I'm also going to sanitize my hands. So after I sanitize all the materials, I'm now gonna open the bag and return all the things that were used in their proper places. Okay, so now I'm going to wipe the plastic lining using the extra towel. Okay, so I'm also gonna place this towel on the plastic together with the soap dish and the other towel. And then I'm going to remove the apron. So since this area is contaminated, we're going to fold it away from the person from left to right. And then the outside side should be inside and the clean side should be on the outside. Okay, from left to right. With its inside part on the inside of the folding. Okay, so since this is contaminated, I'm also gonna place it in a plastic. Okay, so I'm gonna put it in a plastic, and after my home visit, I'm going to wash it in preparation for the next home visit. Okay, so now I'm going to put it inside the sachet bag and also the plastic containing the soap dish and the towel. Then next I'm going to get another plastic. So I have here another plastic for the plastic lining and paper lining. Okay, so I'm now gonna fold the plastic lining. And then place it in a plastic. I'm also gonna fold the paper lining. So in my next visit, I'm gonna use another paper and plastic lining since these linings are already contaminated. And the next is I'm going to dispose the waste receptacle. So after I perform the aftercare, I'm now going to talk to the client and other family members the result of the urine test for sugar and albumin. I'm going to take note of the data gathered, observations, the nursing care and treatment that were rendered, and give instruction of care to the client in the absence of the nurse. Then next is I'm going to make an appointment for my next visit to the family, taking note the date and time. And lastly, we should not forget the documentation as it is our basis for the nursing care plan. That will be all. I am again Jessica Arumamil, a level 2 nursing student from the Science State University. Thank you so much and have a good day.